Turning 65 is a funny milestone. People congratulate you. Maybe your family throws you a small celebration. You start thinking about traveling more, spending time with the grandkids, or finally tackling that list of projects you've been putting off for years. Then your mailbox starts filling up. Letter after letter, brochure after brochure. One talks about Medicare Part A, another mentions Part B, then you see Part C and Part D. Medicare Advantage, prescription drug plans, supplement plans. Suddenly, retirement starts feeling less like freedom and more like you're trying to solve a puzzle without all the pieces. If you've ever looked at Medicare and thought, why does this have to be so confusing? You're definitely not alone. In fact, one of the biggest mistakes people make isn't choosing the wrong Medicare plan. It's making decisions before they actually understand what each part is designed to do. And here's why that matters. Choosing the wrong coverage or missing an enrollment deadline can sometimes lead to unnecessary costs, coverage gaps, or late enrollment penalties that may continue for years. That's why spending a little time understanding Medicare today can save you a lot of money and a lot of frustration. So let's simplify it. Forget all the confusing brochures for a moment. Imagine Medicare as a house with 4 different rooms. Each room has a different purpose. If you walk into the wrong room expecting to find what you need, you're probably going to be disappointed. Let's open the first door. Part A, the hospital room. Part A is the part that's there when something serious happens. If you need to be admitted to a hospital, if you need skilled nursing care after a qualifying hospital stay, if you receive certain home health services or hospice care, that's generally the kind of coverage Part A is designed to help with. Here's an easy way to remember it. A for admitted. You're admitted to the hospital. Of course, that doesn't mean every hospital expense magically disappears. Depending on your situation, there may still be deductibles, coinsurance, or limits on certain services. That's why many retirees are surprised when they receive a bill after assuming Medicare would cover everything. One of the biggest myths about Medicare is that once you enroll, healthcare becomes completely free. Unfortunately, healthcare doesn't quite work that way. Medicare helps, often in significant ways. But helping isn't the same as paying 100% of every expense. Understanding that difference alone can prevent a lot of unpleasant surprises. Part B, the doctor's office. Now let's leave the hospital. You're feeling fine. You simply need to visit your doctor for a routine appointment. Maybe your blood pressure needs checking. Maybe you're seeing a heart specialist. Maybe you need lab work or preventive care. That's where Medicare Part B generally comes into the picture. If Part A is about being admitted to the hospital, Part B is more about the medical care you receive outside the hospital. Think of it this way. Part A helps when you're lying in a hospital bed. Part B helps when you're sitting in a doctor's waiting room. Simple. But here's where thousands of people make an expensive mistake. Some delay enrolling in Part B because they assume they don't need it yet. For certain people, especially those who don't have other qualifying coverage, delaying enrollment can result in a late enrollment penalty that may increase Part B premiums for as long as they have that coverage. That's why timing matters. The cost of waiting isn't always obvious at first. Sometimes the real price shows up years later. Another surprise is that Part B isn't free for most people. Many beneficiaries pay a monthly premium, and higher income individuals may pay more. Again, that's perfectly normal. It simply catches many people off guard because they assumed Medicare meant all healthcare costs had disappeared. Part C. Why is there even a Part C? This is where many people start scratching their heads. If there's already a Part A and a Part B, why is there a Part C? Great question. Think of Medicare, Part C, also known as Medicare Advantage, as another way to receive your Medicare benefits through private insurance companies approved by Medicare. Instead of using original Medicare by itself, some people choose a Medicare Advantage plan that combines many of those benefits into one plan. Depending on the specific plan, it may also include benefits such as prescription drug coverage, dental, vision, hearing, or wellness programs. But here's the important part. Not every Medicare Advantage plan is the same. Different plans have different provider networks, different costs, different rules, different coverage. That's why choosing a plan simply because your neighbor loves theirs isn't always the best idea. Your medications are different. Your doctors are different. Your health needs are different. The best plan for someone else may not be the best plan for you. That's why understanding the details matters so much. And believe it or not, the next part of Medicare is one of the easiest to remember. Yet it's also responsible for some of the most expensive mistakes retirees make. Part D, The prescription drug plan that many people overlook. Let's say your doctor writes you a prescription. You walk into the pharmacy, the pharmacist fills it, you swipe your card, and suddenly you're wondering why the medication costs so much. That's where Medicare Part D comes in. Think of the letter D as standing for drugs. It's the part of Medicare that helps cover many prescription medications through plans offered by private insurance companies approved by Medicare. Now here's where a lot of people get caught off guard. Some retirees look at their current health and think, I hardly take any medication. I don't need a prescription drug plan. It seems logical. Why pay for something you aren't using? But life has a way of changing when you least expect it. A routine doctor's visit leads to a new diagnosis. A simple injury requires medication. A prescription that wasn't part of your life last month suddenly becomes something you need every day. And here's where the mistake can become expensive. If you go without creditable prescription drug coverage when you're first eligible and later decide you need it, you may have to pay a late enrollment penalty that can continue for as long as you have Part D coverage, depending on your circumstances. That's why many financial professionals encourage retirees to think beyond today. You're not just choosing a plan for the person you are now, you're choosing protection for the person you may become in the future. If you found this video helpful, be sure to subscribe for more practical retirement tips, Social Security insights, Medicare guidance, and simple financial strategies designed to help you make smarter decisions throughout retirement. Because the best retirement plans aren't built on guesswork, they're built on understanding.